Hi, I'm Christian Brindle, and welcome to the Everything Medicare Podcast. What's up, Everything Medicare Podcast Nation? This is Christian Brindle. Hope you're having a great week. This is Wednesday, and welcome to episode 110 of the Everything Medicare Podcast, where every single week I bring you 3 podcast episodes where we discuss your Medicare, your Medicaid, your Social Security, and everything that has to do with that golden age called retirement. If you don't know who I am, or if this is your first time watching one of these podcast episodes, my name is Christian Brindle. I host this podcast, and I own a company called Christian Brindle Insurance Services, where we work with all of the largest insurance companies in the Medicare industry, and we help people just like you sort through the different choices that they have, whether it be Medicare supplements or Medicare Advantage plans or something in between, or maybe some ancillary products. We help people find the best available fit to cover them based on their particular needs and preferences. And I get people that ask me all of the time, why do I need anything to go with my Medicare? What is wrong with just taking Medicare A and B and just leaving it at that? And I've actually encountered a couple of people this enrollment period, or I should say since the 1st of October. The enrollment period actually started yesterday, which was Tuesday, October 15th. But I encounter more people than you'd think that just have A and B and think they're good and just leave it at that. So this is going to be a very loaded episode, and forgive me for taking a couple of breaks here to drink my coffee, because during this time of the year, folks, I'm working anywhere between 90 to 100 hours or more a week to make sure that we're taking care of our clients and our customers, and there's quite a few of them that we work with in various different parts of the country, in various different states, and not only that, this podcast is quite a time commitment for us. I am incredibly tired. I'm incredibly fatigued, but I'm going to make sure that I deliver this for you. Okay? Need my coffee. I need it. I need my coffee. Without it, I am useless. Okay? So, how does it work to have Medicare Parts A and Medicare Part B by itself? So in segment 1, we're going to talk about what the coverage looks like. Okay. Segment 2, we'll talk about penalties that you'll have. Because believe it or not, if you just have A and B and that's it, you inquire certain amounts of penalties. Because, sorry, not supposed to do that. You're supposed to get something to go with it. Because it just leaves so much uncovered. And segment 3, I'll give you my final thoughts of this episode, okay? So, let's say, hypothetically speaking, right now, I'm on Medicare, and I just have A and B, and that's it. What does my coverage look like? So let's first talk about Medicare Part A, Medicare Part B, what they cover, and what they don't cover. Medicare Part A covers hospitalization, the hospital room, the bed, the walls, the ceiling, the room that I am in. It also covers skilled nursing, which is like rehabilitation, short-term rehabilitation, but when you spend the night in a rehab center, that's typically what they're talking about in that aspect. They cover blood, okay? They pay for the first 3 pints, no, they don't cover the first 3 pints, excuse me. Like I said, I'm fatigued. It's been a long week already. They cover hospice care, okay? But do they cover all of it? No. They don't cover all these things. And like I said, Medicare Part A is most notably hospital coverage. Like I said, the walls, the ceiling, the bed you're sitting in, all of that stuff. But Medicare Part A does not cover the doctors that are taking care of you. The anesthesiologist, all the doctors you see, all the doctors you don't see, the IV in your arm, the MRI, anything like that. So Part A has its limitations. Medicare Part B, on the other hand, will cover everything that Part A doesn't cover on the medical side, as far as, certain things that need to be covered. Like, for example, Part B will cover the doctors that are taking care of you in the hospital, the anesthesiologist, outpatient surgeries, same-day surgeries, where you walk in, you walk out. You don't spend any time in the hospital. Doctor's appointments, durable medical equipment, amongst other things, home health care, etc., etc., lab tests, a tremendous amount of things, okay? Now, if you have that coverage, why do you need anything else? You might be asking yourself. Because A and B don't cover 100% of those things that I just listed. They actually leave a lot behind for you to pay, and they don't pay even close to as much on their own as you might think. Let me explain. Let's go back to Medicare Part A. Let's say you're hospitalized, and based on what they would actually pay for, the hospital room, the bed, the walls, the ceiling, etc., the first 60 days, like I said, let's say hypothetically speaking, I'm on Medicare A and B. This is happening to me, and I go into the hospital. Whether you're in 1 day or whether you're in 60 days, right up front you have a $1,364 Medicare Part A deductible. So right off the bat, you have that you have to meet. Okay. Let's say you're incredibly sick, and you get put into the hospital for some extent amount of time. Days 61 through 90. After that point, they charge you $341 per day. Let's say you're in after that. Medicare gives you 60 lifetime reserve days. This is all within one consecutive stay. If you go home and then you go back, it starts a new, what they call benefit period, and this all starts over. You have to pay that deductible once again. It's not a one-time-a-year thing. So like I said, Medicare gives you 60 lifetime reserve days after day 90, where they pay all but through $682 per day. And that's all you get. 150 days in the hospital. What about skilled nursing? Rehab. Let's say you need to go to a rehab. The first 20 days are paid for completely by Medicare Part A. But after day 20, they charge you $170.50 per day from day 21 through day 100, and then after that they pay nothing. That adds up pretty quickly. Medicare on blood, Medicare doesn't cover the first 3 pints. You're responsible for that. Hospice care, typically they'll pay 80% and leave you behind with 20% if you needed that. Hospice care, of course, is when someone is terminally ill or they're expected to pass away. It's just a service that comes in and helps make you more comfortable in various different ways. Let's go jump into Medicare Part B. How are you covered with Medicare Part B if that's all you have? You have nothing to go with it. Medicare Part B has a $185 deductible one time a year. That's what it is this year in 2019. There's been whispers about it going up in 2020. We believe it's probably going to go up to about something like $197, but nothing's been officially announced yet, so I'm just going to go off of what it is at the moment, okay? So $185 deductible. However, after that deductible's met, this is for treatment in or out of the hospital by doctors, same-day surgery, physician services, inpatient, outpatient, medical or surgical services and supplies, physical and speech therapy, diagnostic tests, durable medical equipment, etc., etc., etc. There's tons of different things that fall into this category for medical expenses on Medicare Part B. You have the $185 deductible, probably going to be more next year, like I said, in 2020. Nothing's been officially announced, so I'm not going to go with that. I'm just going to go off of what it is at this very second. After that part is met, that deductible, they pay 80% of the bill and leave you behind with 20%. And like I said, if you go into the hospital, Medicare Part A covers the hospital room, the bed, the walls, the ceiling. After that $1,300 deductible is met. But Medicare Part B is needed to pay for the doctors that are treating you and everything else that's happening in the hospital. Everything in the hospital, I should say. So after that, the Medicare Part A deductible of $1,364 is met, and the Medicare Part B deductible of $185 is met, then you pay 20% of the doctor's fees, and that's where they get you. 20% is huge, humongous. Medicare does not have any maximum out-of-pocket limit where they cut things off at. So if it's a $100,000 bill, you're looking at 20 of it. $20,000. That's huge. Let's keep going. Medicare does not cover what's known as the Medicare Part B excess charge. Now, depending on where you might be listening to this from, that could be a bigger concern or not a concern at all. In some states, it's illegal to charge. Some states, they still charge it from time to time. But if that's basically if a doctor has any additional charges they want to tack on, it's their prerogative, and depending on the state, some states it's against the law, some states it's not. But if they did charge it, if you're in a state that allows it, you pay 100% of a Part B excess charge. Let's talk about blood. Medicare, again, does not cover the first 3 pints. You pay for that. And then after that point, you pay 20% of the bill. They pay 80%. Medicare covers lab work 100%, so that you're good there. Medicare covers home health care 100%, so you're good there. Of course, Medicare does not cover custodial care, where someone needs to come in and dress you or anything like that. It's very basic home health care. Durable medical equipment. You have the Medicare Part B deductible of $185. It's a one-time-a-year deductible, but if you haven't met it in a medical service category, you'd meet it here. It's just another place you could trigger it. After that deductible's met, Medicare pays 80% of the durable medical equipment, and you pay 20%. Durable medical equipment, of course, is wheelchairs, oxygen tanks, things along that nature, CPAP machines, etc., etc. Medicare covers no foreign travel out of the country. This is all within the country. So you can see there's a lot left exposed. A lot left exposed. If you went to the hospital and you had any single little bit of things wrong with you, even just setting foot in an emergency room, probably nowadays will cost you 10 grand, 5 to 10 grand by itself, even if you're there an hour or two. Imagine if there's something wrong with you. Imagine if they have to keep you a couple nights. The bill would be humongous. And you'd have deductibles to pay. Yes, that's inconvenient. But the main issue here, folks, is the 20% that you'd have to pay after those deductibles are met. Like I said, if it's a $100,000 bill, you pay 20. Don't go anywhere. We're going to take a quick break after a quick word from this week's sponsor, Randy W. Hall, the Mr. Nice Guy Medicare Advisor. Don't go anywhere. I'll be right back. We'll talk about penalties by having A and B only in segment 2. I'll be back.
What's up, everybody? This is actually Randy W. Hall, Mr. Nice Guy Medicare Advisor, not Christian Brindle, your esteemed host. I'm here to tell you about my Medicare agency, Mr. Nice Guy Medicare Advisor, based here in Tennessee. For the past 10 years, I've been helping Medicare beneficiaries just like you in Tennessee and Kentucky maximize their Medicare. If you're a regular listener of this podcast, you know Christian always encourages you to deal with a broker in your state who sells all the different plans and will give you not just a quote, but also advise you and educate you in a way that is simple to understand. We know how confusing and overwhelming the whole process can be. We do it all for folks on Medicare, from supplements to Advantage plans, Part D, cancer products, hospital indemnities, and more. So if you want to get a free quote or a consultation, I urge you to call 615-578-5174. Again, that's area code 615-578-5174. Or for more information, you can visit my website and read all about me at MrNiceGuyMedicareAdvisor.com. That's all one word, MrNiceGuyMedicareAdvisor.com. And again, why deal with a jerk when you can deal with a nice guy?
Ha ha! Welcome back, folks. Thank you for sticking with me. I hope you enjoyed that message from Randy W. Hall, the Mr. Nice Guy Medicare Advisor. If you live in the states of Tennessee or Kentucky, this open enrollment period, and you need help with your Medicare, Randy's the guy to call. I encourage you to give him a call. All right, let's continue forward with segment 2 of the Everything Medicare podcast. So how does it work if you just have A and B? We talked about the limitations on the medical coverage, but A and B only cover medical bills. They don't cover prescription drugs that you get at the pharmacy and take at home. They don't cover drugs like that, prescriptions. So if you have any prescriptions, you're paying completely out of pocket. You might be able to get a coupon, but sometimes those are limited. Sometimes they don't pay much at all. Sometimes you still pay huge amounts of money with coupons. No drug coverage, no dental, vision, hearing coverage. Okay. You have a filling, a crown, a root canal. You are on your own with Original Medicare only. So, let's talk about penalties, though, because there is one penalty you get. You don't get penalized for not having dental, vision, hearing coverage. The only penalty you get is when you have to go to the dentist and pay out of pocket. But you do get a penalty for not having drug coverage in the United States of America when you're on Medicare. If you do not have credible Medicare Part D coverage in the eyes of the government, they penalize you. Let me explain. How this works something like this. If you do not have Medicare Part D drug coverage, the penalty is a month-by-month thing. It gets bigger for every month you've gone without it. So the longer you go, the bigger the penalty gets. It's not a penalty that shows up on your taxes, like the old Obamacare penalty before that was done away with, thank goodness. But it's not a one-time penalty. However, it's not something that will ever affect you as long as you never pick up drug coverage. So if you think you can go your whole life without drug coverage, be my guest, don't pick it up. But most people need drug coverage at some point. So how does this penalty affect you? Well, let's say you turn 65, you take no drugs. You don't pick up drug coverage. That's what a sane person, the first thing they would jump to is don't pick up drug coverage, right? It makes sense. Why pick up drug coverage if you don't take any drugs, right? Well, Medicare has a horrible program that inflicts their will onto seniors on Medicare, that takes advantage of seniors, that forces seniors, if you will, backs them into a corner, if you will, to pick up Part D drug coverage. And this is how this works. It's terrible. It oppresses seniors, in my opinion. I might get in trouble for saying that, but it's a terrible program. I think it's un-American to force somebody to have insurance if they don't want to. In some instances, I get it. Like car insurance, I'm okay with that. Health insurance, maybe. All right, we can have a conversation there. But drug coverage? Come on. Get out of here. But the government does it anyway when you're on Medicare. What they do is for every month you've gone without drug coverage, the penalty gets slightly bigger and bigger and bigger. It's usually about $4 to $5 a year, roughly, give or take. Don't quote me exactly on the numbers. But let's say you turn 65, you don't take any drugs, like I said, you don't pick up the drug coverage. But let's say 10 years go by, you don't have this drug coverage. And like you know, if you listen to me for some time, you can get drug coverage included with a Medicare Advantage plan, but let's say you pick up a Medicare supplement, and Medicare supplements don't include drug coverage. A Medicare supplement would cover all the medical costs I talked about in segment 1, but it only pays for something if Medicare pays first. If Medicare doesn't pay, the supplement won't either. So let's say you pick up a supplement at 65, you don't pick up drug coverage, 10 years go by, at this point you're 75, you're starting to take more drugs. And paying out of pocket for them is starting to take its toll on your bank account. So you go and look at drug plans. You sign up for a drug plan, let's say it's $25 a month in premium. Well, 10 years have gone by. That's 10 years worth of a penalty. So let's say, for the sake of example, it's $5 a year for every year you went without. So in this example, if it's $5 for every year you went without, you'd be looking at a $50 drug penalty. You pay it the first time? Oh, that's not a big deal, Christian. Nope! Sorry to say. That $50 penalty, assuming that's what it is in the sake of our example, we'll say it's $50, will be added on to your $25 premium on your drug plan, no matter which insurance company you get it through. It's upheld by upheld by Social Security and Medicare. And it's added on to your premium. They call it a late enrollment penalty for drug coverage. So instead of paying $25 for your premium, you have $50 tacked on top of it for the 10 years you went without drug coverage. And this is forever, as long as you have the drug plan. The only way around it is to never pick up drug coverage and always pay out of pocket. Most people need drug coverage at some point in your life. Just because you don't need it at 65 doesn't mean you won't need it at 75 or 85 or 95 or however long you last. I hope all of you keep your health and live incredibly long lives till you're 95, 105, 115. That's what I want for you. But most people do need drug coverage at some point. And there's a lot of people I run into, more than you'd ever imagine, that just have A and B. They've had it for some time, and they learn about this drug penalty, and it's devastating for them. The difference between $25 a month in premium and $75 in our example a month in premium with a $50 penalty, let's say, for someone that went 10 years without drug coverage, is a huge difference, especially someone that's living off Social Security, especially someone that's retired, especially for someone that's on a budget. I don't agree with it. I don't like it, folks. But it's what the government does. The government doesn't give a damn what I think. The government doesn't give a damn what you think. The government does what they want to do, and in this case, they want to penalize you for not taking drug coverage as soon as you become eligible for Medicare. It's a fact. I'm not saying anything controversial here. It's true, it's a fact, it's what they do. It's impacted many clients of mine that came to me after the fact, after they learned that. So if you turn in 65 or you're getting on Medicare, or let's say you're one of those people that just has A and B, I encourage you to pick up drug coverage and don't let that penalty get any bigger. If you don't take any drugs, take the cheapest available drug plan option you have in your area. You can probably get one for $10 to $15 a month depending on where you live in most markets. It's worth it to avoid that penalty just to get you by. Stay with me. Don't go anywhere. Let's take a break. After a quick word from our sponsor, I will be back and I'll share my final thoughts on this topic. Don't go anywhere. Welcome back, everybody. Thanks for not going anywhere, and thanks for sticking with me through this entire episode. Here's my final thoughts on this, folks. You need to understand this stuff, because there is no excuse to just have A and B and that's it. It's in your best interest, if you can't afford anything other than just the Medicare Part B premium, let's say the $135.50, let's say you can't afford a supplement. I understand. You're better off with a $0 premium plan, Medicare Advantage plan, if you have one in your area, than just being on A and B. Because in a lot of cases, most of those plans will come with drug coverage. In most cases, they'll increase your medical coverage. You have better coverage than just A and B on its own. If you don't have a $0 premium plan available in your market, pick one up that's $20, $30 a month in premium. Get something. Because something is better than nothing. You need to make sure that you're protected. Because a $100,000 hospital stay could happen to any of us, no matter how healthy you are. It's a crazy world we live in, folks. You have to make sure that you are protecting your most valuable asset, and that's your health and your well-being. Thank you so much for listening to this whole episode, folks. I hope you enjoyed it. I hope you got something out of it. Hope you learned something on what Medicare does on its own, if that's all you had in the limitations. And as always, folks, we're in the Medicare open enrollment period. If you'd like to work with me or talk with me about your Medicare health plan, my office is licensed and appointed to work with people in the states of Utah, Texas, Oregon, Idaho, and Florida. Again, that's Utah, Texas, Idaho, Oregon, and Florida. We're appointed with all the biggest insurance companies in those states, and our job is to sort through the options, help you find the best thing for you. If you're on Medicare and you're just not sure if you're on the best thing, and you just want to compare it apples to apples and just see if you maybe can do better, or maybe you're turning 65 and you're just not sure which way to go, you feel lost and overwhelmed, I'd love to talk with you if you live in one of those 5 states. Those are the places that we're licensed and appointed with. We're always in more states. I try to announce them when we get them, so keep your ears open for that. But like I said, Utah, Texas, Idaho, Oregon, Florida. Those are the 5 states that we can work with you in on your Medicare. My office number is 801-255-5340, 801-255-5340. Call us between Monday through Friday. Those are our office hours, and I would love the opportunity to be able to work with you and see if maybe I can help. I can't always, but if you don't check, you never know. If you feel more comfortable shooting me an email, you're welcome to do that also. My email is ChristianB, ChristianB, B as in boy, ChristianB at xmission.com. The letter X and then the word mission.com, MISSION.com, ChristianB at xmission.com. And as always, folks, if you're listening to us on a platform that allows you to do so, please give us a 5-star review. It helps us reach more people just like you and provide a message that seniors desperately all over the country need to hear. You need to be empowered on your Medicare. You can't do that if you don't understand your Medicare. That's my motto, that's my story, and I'm sticking to it. Thank you for watching. Thank you for your support. Thank you for listening. I can't tell you how much I appreciate it. And we will be back with another episode on Saturday. Take care.